How you doing there? Dr. James Petrick with Prior Lake Spinal Care. I want to talk a little bit more about pain at the base of the skull after seeing a chiropractor. There's all sorts of reasons that this can happen. Read in the text of this blog post to learn more about that. But I want to specifically highlight some things about the actual anatomy. So if I'm facing this way, here we have a cutout of the head. So this is the base of the skull right here. And this is the C1 vertebra, also known as atlas, right here, cut away. And you see this blue little lining right here? That's called the dura. But I want to back up for a second and talk about the atlas. Atlas, from Greek mythology, was that titan that held the world on his shoulders. So atlas is the top bone, also called C1 in your spine. And it's rightly called atlas because it has a big job. It has to support the weight of your 13 or so pound head, which is about the weight of a typical bowling ball. So it's actually pretty heavy. And that situation can work as long as the vertebrae are in good alignment and they're in a balanced position. What can happen is if C1 slips out to the side or if it rotates like this, is that the base of the skull right through here, there's a membrane, a connective tissue bridge right here connecting this muscle, rectus capitis posterior minor. It's just a very, very small muscle that connects the base of the skull to the upper neck vertebrae. But perpendicular to that, there's this connective tissue bridge, and its job mainly is that when you look down and up, that the brainstem doesn't actually go up and down and wiggle and move around, because if it did that, then it would be more prone to injury. But an unfortunate situation can happen when C1 slips out to the side or if it rotates, it can actually create more tension on that little membrane, that little connective tissue bridge right there. And then you see how the dura along the back of the brain, it goes up, it actually encases the entire brain, your entire central nervous system actually, including your spinal cord. And what can happen is since that ligament connects to the dura, the outside skin, we'll call it, of the brain, okay, it can create tension like this, right? My head's kind of a good example because I don't have hair, but it creates this tension, this kind of pulling at the base of the skull. Especially if that discomfort radiates forward towards the eyes, that's a really, really big sign that the C1 is not in correct alignment. Every chiropractic technique is a little bit different. Here, we specialize in the NUCA method, which stands for the National Upper Cervical or Upper Neck Chiropractic Association. And it's based on the idea that when that C1 vertebra and the axis, atlas and axis, the top two bones in the neck, are not quite in the right position, then yeah, it can create pain at the base of the skull and other problems. So to learn more, feel free to shoot us a message, or we'd be happy to do a consultation with you over the phone or in person. There's absolutely no charge whatsoever. Thank you for watching.